Hello, this is Optimum Health for All. I'm your host, OJ Odia.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today we're going to talk about heart failure in details. We've talked about heart failure before, but today we're going to go a bit more into what heart failure is, how does it present, and what do we do for patients who have heart failure. Also, we would like to use this opportunity to endeavor you to please listen, please subscribe to the channel, and let us form a community of advocates for good health. Today we have Professor Augustine Obasohan. He's a professor of medicine and cardiology. He's a very senior person, an elder in the profession, and we're going to talk about heart failure. Professor Obasohan, you are welcome.
Thank you very much.
Now, what is heart failure?
Good. Heart failure is a term that is used to describe a situation where the heart is not performing optimally. I know it's a term that people get scared of when they hear the heart is failing. But we reassure people that if the fact that the heart is failing does not mean that nothing can be done and that things are very bad. No. When the heart is not performing optimally as it should do, we say the heart is failing to perform its duty. That's how the term heart failure came about. The heart is failing to perform its duty optimally. What is the duty of the heart? It is to pump blood around the body. It receives the venous blood. After purification, then it pumps it around the whole body. And when it does not do this efficiently, we use the term the heart is failing. And we sometimes like to use a measure. If it's doing 50% of what it's supposed to do, we said it is okay. If it is performing less than 50% of what it's supposed to do, we say the heart is failing. So there are various degrees of heart failure from anything. So that's a general term for heart failure. Although there are also some circumstances when it may appear to be performing up to 50% or more, but it is struggling to do so.
It's not doing so at this optimum performance.
It's not doing so normally.
Yeah.
It is struggling to do so. It needs a high venous return to do so. Then the term is also used as heart failure. Now, how does it manifest? How do we know that that state of heart failure exists? If it's performing optimally, all systems in the body will be working well. You are able to rush to do the things you want to do. Your legs are not swollen. You are not breathless. But when it is not doing so, the first sign you will notice is that when you try to do a little more than usual, you are breathless, like climbing upstairs, like rushing to a meeting, carrying a heavy shopping, or indeed, play any type of play. The person becomes breathless and you are having difficulty doing so. No sooner than that, the body starts to accumulate fluids and you will see swelling, which will be from the most dependent part, swelling of the legs. And that swelling of the legs may progress from the feet up to the ankles, and it may go up, which the doctor will find out during examination. The person starts to cough ceaselessly. Initially, the cough will be dry, but after some time, there may be streaks of blood, or indeed the sputum may be foaming. So these are early features of heart failure. So let's take that as a beginning, as a reasonable definition in lay terms of what heart failure is.
So now an individual notices some of these complaints, these features. What do you advise him or her to do?
Good. He should go to seek a doctor. He would naturally first see a general practitioner, general duty medical doctor, who will recognize that this is a heart issue and will refer him to a heart doctor called a cardiologist. A cardiologist is a specialist physician who deals with heart matters. So when he goes to see a doctor, the doctor will examine him and use some investigations to confirm that yes, the patient is in heart failure. And when he has done so, he will institute appropriate treatment which will make the patient feel better. And a lot of the patients will feel very much better when they are appropriately treated.
Okay. So what are the things that could lead to heart failure?
Good.
For example, we know that the heart will not just fail on its own. There must be some factors that will lead it to not being able to perform its duties as optimally as possible.
Yes. There are many factors that can lead to heart failure. And some of them are environmentally determined. What we mean is that the commonest cause of heart failure in one particular part of the world may not be the commonest in another part of the world. But generally, in our environment, and indeed in many parts of the world, hypertension is the greatest cause of heart failure, probably accounting for 60 to 70% of heart failure. Then, rheumatic heart disease.
Is it the one they call rheumatism?
Good, good. The word rheumatic and rheumatism are related. We use the lay term rheumatism refers to a joint problem. But the word rheumatic heart disease was also coined because it was heart disease that's also relating to
The
joints. So that's how the rheumatic heart disease. But there is something that causes it, an offending infection which the body is fighting against, causing heart disease.
Okay.
So that's the second one. Then there is heart muscle disease in our environment, though common. But when we are teaching students, we like to mention it last. But since we are talking about general people, we may not go that order. Heart muscle disease of unknown cause. So the heart muscle is not pumping well, a cardiomyopathy.
Okay.
We've mentioned it quickly because it is fairly common. But when we're in medical school, we're teaching students, we say mention it last first because you must exclude other things first before you get there.
Sure.
But in terms of how common it is,
So
and then there are other causes.
Yes.
There's anemia,
So anemia means shortage of
blood. Then there
in the
is a common one, especially abroad, we call ischemic heart disease. What does that mean? Reduced blood supply to the heart muscle.
Okay, so the heart pumps blood to the rest of the body.
And it
Does it
also pumps to itself.
So it has to pump for its own supply.
Absolutely.
Okay.
That's what is called ischemic heart disease or coronary artery disease.
This is the same thing as heart attack.
Okay. Heart attack comes from there, but we are describing now what causes heart failure, what leads to it. You know, I also say, you know, just like the law of nature, you must take care of yourself first. Just like in the harvest season, the first fruits, the best fruits are stored by the man himself. So when the nature, God put it there, when the heart pumps out blood to other organs, the very first branches goes to itself to feed
So
itself,
that
the heart,
it will be
so that it is
strong
well
enough
enough to pump around the
for
whole
the rest
body.
of the
So
body.
the very first two branches coming from that heart feeds itself. They are called the coronary arteries. When there is disease of those coronary arteries, that's what we call ischemic heart disease.
Which also causes
That
heart
is
failure.
what also causes heart attack.
Attack, okay.
If there is a sudden blockage, that's heart attack.
Okay.
But heart failure is not a sudden thing. It's a gradual thing that develops.
So it builds up.
So if that occurs slowly, it can cause heart failure.
Okay.
But if it suddenly blocks, that is what
That's
is
what
described as heart attack.
Okay, so there's a difference between
So
heart
there's
failure
a difference
and
between heart failure and heart attack. Heart attack, in fact, the word heart attack is a lay term to show that it is sudden attack. The heart suddenly attacks the person, he has chest pain, he collapses and may die. That's a heart attack. Heart failure is different. The heart is not able to pump blood, and you know, as you do things, as I said earlier, those features appear. So there's a difference between heart failure.
Okay, so
and heart
the
attack.
person comes to hospital, the doctor has done his tests and so on. Doctor will now have to do some form of treatment.
Yes.
Now, so let's say the doctor has applied treatment, drugs, some other forms of treatment and so on. What happens next? What does the patient do? Does the patient go away even if after feeling better and not come back to hospital, or is this something that is lifelong?
Good. This is it. It is something that usually is lifelong. Quite often, the medications the person are giving are to continue to help the heart. So it may not just be a situation where he will stop taking the medication.
Okay.
So he must go to hospital to check from time to time. Many patients don't find this palatable or easy to take. But I remind them that there are many things that we do throughout life. We eat throughout life. We treat many things throughout life. So if you take your medications to make you healthy and you can then live a fairly normal life, then we have achieved most of the things that...
If you are taking your medications and you are okay,
yes,
much better, you're still coming back to hospital for checkup and other forms of treatment.
good.
How do you prevent going to heart failure again? For example, all those factors that led to the heart failure, how can it be prevented?
Good. One, the first thing to prevent going into that heart failure again is to take your medications.
Okay.
Prescribed. Two, some of those medications the cardiologist is prescribing for you will be treating that thing that brought the heart failure in the first instance.
Treating the underlying
cause. Underlying cause. So if it was hypertension, some of those drugs will include treatment for hypertension. If it was anemia, there was part of the treatment.
To correct the anemia.
Okay. If it is lung disease, what we call some lung disease can cause heart disease, we will be treating that. If it is ischemia, the doctor will look for a definite treatment to remove that ischemia. Okay. So not only are you treating the heart failure itself, you are treating any of the things that you find that is causing the heart failure. Okay. Remember, there are many other causes. We just mentioned 4 or 5.
Few, yes.
There may be irregular heart rhythm, arrhythmias. There may be other.
That can also be corrected.
Which can also be corrected.
Okay. So whatever the cause is, a doctor may be able to correct them.
Absolutely. That's the job of the cardiologist.
Okay, and
Want to find out what is the cause of it. It's not enough to just treat the heart failure. He finds out the cause of the heart failure, so he treats it.
Okay. I will continue to monitor.
And continue to monitor you and see what other complications that may arise.
Okay. So the most important message I think you are telling us now is that the patient should be patient. No pun intended, so that I can be coming to hospital, taking the medications, seeking the advice of the doctor, and carrying out preventive measures, which the doctor may advise from time to time.
Absolutely. That was why, in fact, the word patient came from in those days, even though we tend to want to use the more friendly or commoner word client. Yeah. But basically, he has to be patient to receive medications to get back to his health.
Okay, thank you, Professor Obasohan. So, any advice that you want to give viewers regarding prevention of heart failure?
Well,
General
yes,
advice for us.
general advice is that one, because heart failure is commoner as we age, it is advised that as you get to 40, 45, you should have routine medical examination at least once a year. Many of those factors that cause heart failure tend to occur from those ages. Your blood pressure will be checked, your heart rhythm will be checked,
Blood count,
and
all that.
all blood count.
Yes.
So you go. And two, take life easy. We'll talk about general life measures, avoid excessive salt consumption, avoid excessive weight, avoid excessive alcohol consumption. These are general health measures which also help to prevent
lifestyle modifications.
lifestyle changes. Yes.
Now let's talk about the issue of drugs. Now, some of the drugs can be expensive. How do we ensure, what do you recommend to governments, to either at the national or sub-national levels, or to families to ensure, at least make sure that the cost of treatment does not cripple or prevent them from enjoying their life as were? Is there any way of asking government for health insurance or coverage, what they call, giving
In fact, you have hit the
incentives and so
you have hit the nail on the head. Medications cost all over the world. It's not cheap. It's expensive because these are manufactured, synthesized. Even if coming from natural organic material, they are synthesized in its purest form. So they are not cheap, especially when they are drugs that people have to take lifelong.
Okay.
So the cost becomes high. Therefore, many societies would have health insurance schemes, the type that has been begun by the federal government and that is being adopted by many state governments, so that when you are well, you contribute a little bit of your salary so that government will cover you. Health insurance schemes are very important because the problem with our people, many are paying out of their pockets, and out-of-pocket expenditure cannot provide guaranteed health or cost of medication.
So there are health management organizations that one could talk to, and
so there should be HMOs, health maintenance organizations, so that they organize insurance coverage properly. You see, these are important things. Like, it's often an election matter for discussion in advanced countries. How will they cover people's health? So these are issues. Health insurance is a sure way. People take their personal insurance, but there must be general insurance coverage for the generality of the people.
So, thank you.
Thank you very much.
We're particularly delighted that you are here today and to enlighten us and our viewers on this very important issue of heart failure. Thank you very much. Viewers, thank you for viewing this program. Please subscribe and like, share to your friends, make it as widely publicized as possible. Bye for now.
Thank you, Professor.
Optimum Health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the machine, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum Health, you know what I mean. Optimum Health for all.